Thank you for choosing intelligence. Appendicular division of the skeleton. Name this anatomical area. Clavicle. The clavicle bone is also known as the collar bone. It is the only long bone that lies horizontally. Name this anatomical area. Clavicle Acromial End. The clavicle acromial end is identified as the bony peak at the shoulder. Name this anatomical area. Clavicle Sternal End. The clavicle sternal end attaches to the manubrium of the sternum. Name this anatomical area. Clavicle superior border. The superior border or superior surface is the area of the clavicle that faces up when attached to the skeleton. Name this anatomical area. Scapula. The scapula or shoulder blade connects the humerus with the clavicle. Name this anatomical area. Scapular spine. The scapular spine is a protruding plate of bone in the upper portion of the scapula. Name this anatomical area. Supraspinous fossa. The supraspinous fossa is located in the posterior area of the scapula. Its medial 2/3 give origin to the supraspinatus muscle. Name this anatomical area. Infraspinous fossa. The infraspinous fossa is recognized by large area covered over the posterior portion of the scapula. Name this anatomical area. Subscapular fossa. The subscapular fossa is recognized by the large area covered in the anterior portion of the scapula. Name this anatomical area. Clavicle axillary border. The axillary border is the thickest of all the borders and can be viewed by examining the outer sides of the clavicle. Name this anatomical area. Vertebral border. The vertebral border, or medial margin, is identified as the inner border of the clavicle, as opposed to the axillary border that is located on the outer edge of the clavicle. Name this anatomical area. Glenoid Cavity. The glenoid cavity is a part of the shoulder that rotates with the humerus. Name this anatomical area. Clavicle Acromial process. Articulates with the collarbone clavicle. It is recognizable from the posterior and is directly connected to the scapular spine. Name this anatomical area. Clavicle Coracoid process. The Coracoid process helps to stabilize the shoulder. It is better recognized anteriorly. Name this anatomical area. Humerus. The humerus is the upper arm bone. Name this anatomical area. Humerus Head. The humerus head articulates with the glenoid cavity. Name this anatomical area. Humerus greater tubercle. The humerus greater tubercle assists in muscle attachment of the supraspinatus. Name this anatomical area. Lesser tubercle. The lesser tubercle is more medially located than the greater tubercle. Name this anatomical area. Deltoid process. The deltoid process is where the deltoid muscle attaches. Name this anatomical area. Capitulum. The humerus capitulum connects to the radius head. Name this anatomical area. Trochlea. The humerus trochlea articulates with the ulna bone. Name this anatomical area. Coronoid fossa. During flexion, the coronoid fossa receives the coronoid process of the ulna of the forearm. It is directly adjacent to the radial fossa of the humerus. Name this anatomical area. Olecranon fossa. The olecranon fossa is a deep depression on the posterior side of the humerus. Name this anatomical area. Lateral epicondyle. The lateral epicondyle allows attachment to the radial collateral ligament of the elbow joint, tendons, supinature and some of the extensor muscles. Name this anatomical area. Humerus medial epicondyle. The medial epicondyle allows attachment to the ulnar collateral ligament of the elbow joint, pronator teres, common flexor tendon, and some of the flexor muscles of the forearm. Name this anatomical area. Humerus anatomical neck. The humerus anatomical neck is best represented by the groove separating the head of the humerus from the two tubercles. Name this anatomical area. Humerus surgical neck. The surgical neck of the humerus is just below the tubercles of the lesser tubercle and greater tubercle. Name this anatomical area. Humerus intertubercular groove. The humerus intertubercular groove is a groove that separates the lesser and greater tubercles. Name this anatomical area. Radius. The radius is the forearm bone that is lateral to the ulnar bone. Name this anatomical area. Radius head. The head of the radius is cylindrical to articulate with the humerus. Name this anatomical area. Radius neck. The neck of the radius lies between the head and the tuberosity. Name this anatomical area. Radius tuberosity. The radius tuberosity is on the medial side below the neck of the radius. It is divided into a posterior rough portion for the insertion of the tendon of the biceps brachii and an anterior, smooth portion, that the bursa is interjected between the tendon and the bone. Name this anatomical area. Radius styloid process. The radial styloid process is a projection of bone on the lateral surface of the distal radius bone. Name this anatomical area. The ulna is one of the two forearm bones that is medial to the body. Name this anatomical area. Ulnar head. The ulna head is where it articulates with the articular disc. Name this anatomical area. Ulnar styloid process. The ulnar styloid process attaches to the collateral ligament of the wrist. Name this anatomical area. Ulnar Olecranon process. The ulnar Olecranon process forms the exterior bump of the elbow and fits into the fossa of the humerus when the arm is extended. Name this anatomical area. Ulna Semilunar notch. Trochlea notch. The ulnar semilunar notch articulates with the trochlea of the humerus. Name this anatomical area. Ulnar Coronoid process. The ulnar coronoid process is an attachment site for the brachialis muscle. Name this anatomical area. Ulnar radial notch. The radial notch of the ulnar, also known as the lesser sigmoid cavity, receive the circumferential articular surface of the head of the radius. Name this anatomical area. Carpal bones. The carpal or carpus connects the hand to the forearm. It allows effective positioning of the hand, and use of the extensors and flexors of the forearm. Name this anatomical area. Metacarpal. The metacarpals connect the carpals to the proximal phalanges, and produce knuckles. Name this anatomical area. Proximal phalange. The proximal phalange are bones found in the fingers and toes. Name this anatomical area. Middle phalange. The middle phalanges are also known as the intermediate phalanges. They are bones located in the fingers. Name this anatomical area. Distal phalange. The distal phalange are also called fingertips. Name this anatomical area. Tarsal. The tarsal, or tarsus, is a collection of 7 articulating bones in each foot, between the lower end of the tibia and fibula. Name this anatomical area. Calcaneus. The calcaneus is also called the heel bone. Name this anatomical area. Cuboid. One of the several tarsal bones of the foot. Name this anatomical area. Navicular. The navicular is one of the several bones of the foot that resembles a small boat. This is how the name was established. Name this anatomical area. Talus. The talus is also called the ankle bone. Name this anatomical area. Medial cuneiform. The medial cuneiform is the largest of the cuneiform that is located on the medial side of the foot. Name this anatomical area. Intermediate cuneiform. The intermediate cuneiform, also known as the second cuneiform bone, is located between the medial and lateral cuneiform bones. Name this anatomical area. Lateral cuneiform. The lateral cuneiform, also known as the third cuneiform, is located between the intermediate cuneiform medially and the cuboid laterally. Name this anatomical area. Metatarsal. The metatarsal bones, or metatarsus, are a group of 5 long bones in the foot, located between the tarsal bones, midfoot, and phalanges of the toes. Name this anatomical area. Phalange. The phalanges are finger and toe bones. Name this anatomical area. the nominate bone or os coxae. The os coxae, also called the hip bone, the nominate bone, pelvic bone, or coxal bone, is a large flat bone. It is comprised of the ilium, ischium, and pubis. Name this anatomical area. Ilium, the uppermost part of the pelvis. Name this anatomical area. Ischium. The ischium is the lower portion of the os cox and articulates with the femur. Name this anatomical area. Pubis. The principal bones that comprise the pelvis. Name this anatomical area. Pubic symphysis. The pubic symphysis is also called the symphysis pubis. It is a cartilaginous joint that unites the superior rami of the left and right pubic bones. Name this anatomical area. Sacroiliac symphysis. The sacroiliac symphysis, also known as the sacroiliac joint, is an amphiarthrodele joint, formed between the auricular surfaces of sacrum and the ilium. Name this anatomical area. Tuberosity of ischium. The tuberosity of the ischium is also known as the ischial tuberosity and sits bone. It is a large swelling posteriorly on the superior ramus of the ischium. Name this anatomical area. Iliac crest. The iliac crest, also called the crest of the ilium, forms the prominence of the hip and is the superior border of the wing of ilium. Name this anatomical area. Acetabulum. The acetabulum, also known as the Glenoid Cavity, is a concave surface of the pelvis that creates a hip joint as the head of the femur attaches. Name this anatomical area. Obturator foramen. The obturator foramen is a hole created by the ischium and pubis bones of the pelvis. The hole allows nerves and blood vessels to pass. Name this anatomical area. Greater sciatic notch. The greater sciatic notch allows passage to a variety of muscles, blood vessels, and nerves. Name this anatomical area. Lesser sciatic notch. The lesser sciatic notch provides a passageway for tendons, vessels, and nerves. Name this anatomical area. Ischial spine. The ischial spine is a pointed, triangular projection of the ischium. Name this anatomical area. Anterior superior iliac spine. The anterior superior iliac spine provides attachment for the inguinal ligament and the sartorius muscle. Name this anatomical area. Anterior inferior iliac spine. Anterior inferior iliac spine is the origin of the straight head of the rectus femoris muscle. Name this anatomical area. Posterior inferior iliac spine. The posterior inferior iliac spine is a projection of bone that provides attachment for sacroiliac ligaments. Name this anatomical area. Posterior superior iliac spine. The posterior superior iliac spine attaches to the oblique portion of the posterior sacroiliac ligaments and the multifidus. Name this anatomical area. Femur. The femur of the skeleton is the thigh bone. Name this anatomical area. Femur head. The head of the femur is the ball and socket joint of the femur. Name this anatomical area. Femur neck. Connects the femoral head with the femoral neck. Name this anatomical area. Femur retroconter. The femur retroconter is where the abductor muscles attach that move the femur outwards. Name this anatomical area. Femur lesser trochanter. The femur lesser trochanter is where the adductor muscles attach and move the femur inwards. Name this anatomical area. Femur medial condyle. The femur medial condyle is the medial part of the hinge joint. known as the knee joint. Name this anatomical area. Femur lateral condyle. The lateral condyle is the lateral part of the knee. Name this anatomical area. Femur patellar surface. The femur patellar surface creates a surface for articulation. Name this anatomical area. Femur popliteal surface. The popliteal fossa, also known as the knee pit, or poplet, is a shallow depression located at the back of the knee joint. The bones located in the popliteal fossa are the femur and the tibia. Name this anatomical area. Tibia. The tibia is also known as the shin bone or shank bone and is the larger of the two leg bones. Name this anatomical area. Tibia medial condyle. The medial condyle is the medial section of the upper extremity of the tibia. Name this anatomical area. The tibiolateral condyle. The tibiolateral condyle is the upper lateral extremity of the tibia. Name this anatomical area. Tibia medial malleolus. The medial malleolus is the bony prominence on the medial side of the ankle bone. Name this anatomical area. The tibia tuberosity. The tuberosity, also called the tibial tubercle, is an oblong elevation on the proximal anterior area of the tibia. Name this anatomical area. Tibia intercondylar eminence. The intercondylar eminence is the area between the lateral and medial condyle. Name this anatomical area. Fibula. The fibula is the calf bone located on the lateral side of the tibia. Name this anatomical area. Fibula head. The upper extremity of the fibula is called the head. Name this anatomical area. Fibula lateral malleolus. The lateral malleolus is the prominence on the outer side of the ankle, created by the lower end of the fibula. Name this anatomical area. Patella. The patella is a circular triangular bone that is also known as the kneecap. Please support free education. We appreciate your subscription and your like submission.